Central Texas Pain Center.
Well, if you suffer from back pain, you're not alone. Dr. Samuel Stevens from Central Texas Pain Center, a practice partner of Pain Specialists of America, is here to help. It's nice to see you. Thanks for coming in this morning.
It's a pleasure to be here.
You know, a lot of people put up with a lot of pain before we actually go in and see someone. Yeah. When is the right time to see a specialist?
So a couple important points there. First off, if the pain is associated with numbness, weakness, loss of bowel or bladder control, so things like that, those can be very worrying signs, and you should probably see a doctor right away. When it comes to chronic pain or pain doctors, interventional pain doctors specifically, oftentimes you'll see us a little bit down the road, potentially after physical therapy or seeing a primary care doctor, taking anti-inflammatories, things like that.
A lot of people do suffer from back pain, but what is the typical cause of back pain?
Sure, good question. This is just a model of the human spine, and here you can see the neck, the mid-back, the low back. These areas are very frequently causes of pain. The neck, for example, you can have arthritis pain in the neck. You can have pain after a traumatic accident like a car accident. Another really frequent cause of pain that I see in the office, you have discs that are cushions between the vertebra or your backbones, and these discs can push against nerve roots and sometimes can cause things like numbness or tingling in your hands. Or that same thing can happen for your legs. So those are probably the most common types of pain. With regard to other types of pain, I see people with knee pain, hip pain, shoulder pain. All of those large joints are very, very common sources of pain.
We're seeing a video here. This is sort of a specific kind of solution that you can use to target some of those areas and fix the pain that people have. What is that called?
Right. So this is called spinal cord stimulation. So this is a therapy that's been around for a while. You saw in that video a person it had like a painful leg. You saw the red spreading up the leg. With spinal cord stimulation, you put an insulated, flexible wire inside the spine, and it changes the way that the spine and the brain talk to each other. So it's one way of many of reducing pain. Kind of one of the main things to keep in mind are there are a lot of methods of treating pain that are minimally invasive, that you don't have to have surgery for many types of back pain. You're able to turn off certain nerves either in the back or in the large joints of the body, and to get help that way.
There really is no need to put up with the pain. I think we feel like we just have to deal with it, but in a lot of cases this is something that can be treated and fixed.
I agree.
Absolutely. All right, so here's the deal, guys. We have a wonderful facility here in San Antonio for you to get help. It is the Central Texas Pain Center, and if anything that we talked about this morning sounds like it could be you, call them, set up an appointment, because it is time to start feeling better. Central Texas Pain Center on Bassey Road here in San Antonio. The phone number is on your screen. It's 614-9955, and you can go online to painspecialistsofamerica.com for more.